Tell us when we're live.
And you're live.
We are live?
Yes, go right ahead, Andre.
Okay, and the YouTube will show it as well? Yes, it does. Thank you. Hello, everyone. Welcome to the second global webinar of the EndPandemics campaign. I'm Andrei Kushlin, Senior Advisor to Transparent World, a geospatial solutions NGO, and a member of the campaign's coordination team, speaking to you from my home in Moscow, Russia. When we met for the first time in this format around Earth Day in April, this was a very passionate meeting of hearts, a reflection of a growing crowd of concerned citizens and organizations whose interests in safeguarding the planetary health became suddenly enlivened by the global shockwave of the COVID pandemics. But we were still without a clearly defined common goal or a plan or a structure to support it at that time. Today, merely 2 months later, we are a campaign with a catchy name, EndPandemics.Earth, which emphasizes the Earth dimension, a mission statement that is sharply focused on solutions, a website platform with great collaboration tools, and a fast-growing alliance of participating organizations, big and small, formal and not so formal, and an even bigger global crowd of those who watch what we are doing, thanks to our great video that CNN is now running 4 times a day, 7 days a week. To further build our movement's breadth and strength, we now need to show that we have not only hearts, but also brains and muscles to be able to attract the attention of serious players at all levels of impact. Let me switch to my slides. So this is our campaign name. In terms of our purpose, we do not pretend to address the entire complexity of post-pandemic renewal and preparedness, but we focus sharply on the root causes, that is commercial wildlife trade, disruption of wild habitats, and wildlife dependence of poverty-affected livelihoods, to reach lasting solutions that won't have to be changed with every new virus. It does not only sound right, it has a major economic rationale, as we will see today from our One Health presenters. We harness the energy of the global shockwave to promote crowdsourced solutions across sectors and measure their impacts. We solicit and promote actions across all impact levels: communities, governments, businesses, consumers. And our main instrument is the solutions map that allows to work across various actions and impacts to ensure the maximum cumulative results from individual inputs. Today's speakers will present to us the One Health approach that has already become not just an academic viewpoint, but a robust operational and institutional framework to manage the complex risks of human-animal environment interfaces. Our guests will illustrate how this framework can help guide the needed solutions in frontline actions, public policies, business practices, and citizen engagement with relevant consumer behavioral changes. With this, I would like to pass on the baton to Steve Galster, our cheerleader, CEO of Freeland, based in Bangkok, Thailand, to introduce the video and our first speaker. Steve, over to you.
Thank you, Andre. First of all, it says Onkuri in my slate. That's not my name, obviously. That's my wife's name. I'm using her computer tonight. So when we started the EndPandemics.Earth campaign, we realized that we needed to get the key message out as efficiently as possible on a global scale. So we decided to make a short video, and we did that in cooperation with AsiaWorks and Sustainable Human, and the actress and supporter of ours, Jane Seymour, who showed up at our first webinar on April 20th, agreed pro bono to do the voiceover. Then we were very grateful and very fortunate to come into contact with a company named Be Grim, which helped us. We were going to share the video through social networks. Be Grim agreed to join and support the campaign and sponsor the placement of this 1-minute message on CNN, which is now airing almost everywhere outside the United States globally, 4 times a day for like the next four months. So with that, I think we're ready to show the audience the video.
And
Hello?
do you need help? Do you need help with the video, Dan? Okay.
I don't hear.
Did it come through okay?
I could not see anything.
Did we have the video?
I did play it.
Did it come through?
No, it's not come through, Dan.
Okay, how about, can you see it now?
Yeah, we can see it now.
Okay, here we go.
Yes.
Did the audience see it?
Here we go, let's try it again.
We can see it now.
I think there's no sound of the video.
Dan, you can reshare it and tick the button that says share audio as well.
It began to bite back. Primates and HIV, civets and SARS, bats and Ebola. COVID-19 is not the first pandemic, and it won't be the last.
There we go, there we go.
We knew it was coming. The signs were all there. We knew we had to change, but we didn't. Destroying wild habitats, exploiting wildlife, turning a blind eye. Maybe it would go away. It didn't. It began to bite back. Primates and HIV, civets and SARS, bats and Ebola. COVID-19 is not the first pandemic, and it won't be the last. Unless we deal with the root causes. It's time to stop the wildlife trade and to support compassionate, sustainable farming to protect our planet. Let's change our relationship with nature forever. For all life on Earth.
Thank you, Dan, for showing the video. So the audience will have noticed at the end of the spot, there is a website linked to the EndPandemics campaign website. It shows all the organizations there. And you also saw a logo called BGRIM. And BGRIM is a multinational conglomerate that is active in healthcare, energy, building and industrial systems, real estate, e-commerce, and transport. It was founded in 1878 and is based in Bangkok. And we're fortunate tonight to have with us Mr. Harold Link, who's the chairman of BGRIM, who can perhaps tell us why BGRIM joined this campaign and if he has any insights or recommendations to pass either to the business community or from the business community in contact. Mr. Link, welcome. I know you're in Bangkok, so I'll say good evening.
Good evening. Thank you very much, Mr. Costa, Steve. So thank you for inviting me to this illustrious meeting. Well, I think what you do is trying to achieve is wonderful, because we are now all suffering, the whole world, from the results of wildlife trade. Now, personally, I love tigers, and our company has been supporting protection of tigers for many years, together with the World Wildlife Fund and the Ministry of Natural Resources and Environment in Thailand. And then also our whole family, we love to ride and we support the riding sport. And now there's another virus that has been biting us, which is the African horse sickness, which comes from zebras in this case, and 95 of all horses who will be infected died. So I think it's very clear and obvious to everybody that if we can stop the wildlife trade, then the chance of having these viruses is much less. Or the other way around, if we continue wildlife trade, then we will definitely have the next pandemic. And if you look at what happened in 1918 to 1920, there was the first wave, what was relatively milder than the second and the third. So 50 million people died, and I think nobody wants that. So all the friends I talked to and everybody in government I talked to, they're also interested in stopping wildlife trade, but to finally implement it will probably not that easy, but I think we have a good chance in Thailand, and we will do our utmost to try to convince those who can make it happen to make it happen. And already the Minister of Natural Resources, he made an edict already that would stop most of it. But I think there's still some way to go, and all my business friends, they're all for it. So wish you all the best.
We thank you for joining us. I'm happy to say that you say your business friends are also supportive, and we look forward to learning more about that, because this is a part of a series of webinars, and you're the first representative of a major company to have joined us. We thank you for your support and sharing your insights, and we hope to hear more from you in the future. So,
okay, thank you. Goodbye. Bye.
Thank you very much.
over to you, Andre.
Thank you, Steve, and thanks, Mr. Link, for your very insightful remarks about the business practice approach. Now let me move to our next speaker. Olga Jones. She's a senior fellow at the Harvard Global Health Institute. And before Harvard, she had a distinguished career of over 30 years at the World Bank, where she worked as a health sector economist. She coordinated the World Bank's operational responses to avian flu and pandemics, and served as a macroeconomist for policy reform programs. In her blog, Danger of a Pandemic, that Olga wrote 7 years ago, she predicted with a chilling precision the economic dimensions of the next pandemic crisis that the world is now living through. She now focuses on pandemic and epidemic risks through understanding of links to economic development, policies to contain antimicrobial resistance, and the role of One Health approach. She's connected now from the Boston area in the United States. Olga, you have the floor, and I'll be ready to switch your slides on when you say so. Olga, Mike, please put on your mic.
Okay, got it. Thank you. Yeah, thank you for this introduction, and thank you very, very much to invite me to be part of this event. It's really exciting to see those stakeholders that are coming together to be concerned about this topic that's at the interface between human and animal health. We have been working on this for a number of years, since the avian flu response for maybe 10 years or so, 10 years ago or so. And it just does not have much traction, except in the context of an emergency like this. So it's really excellent that you are doing these seminars. So I want to talk about what is One Health very quickly, and why is it important for us to hopefully use it. So can you please start the slides? And we are thinking about One Health with respect to microbial threats. These are the threats of infectious diseases, and also includes antimicrobial resistance. Basically, it's the humans and the animals against the microbes. That's a sort of an epic struggle of millions of years. So next slide, please. Okay, One Health is often presented as the intersection between human health, animal health, and environmental health. What's important to note is that it's not all of health. One Health is concerned about the overlaps where human health risks and animal health risks are the same or are closely interlinked. That's where we often see gaps in attention and gaps in the way the risks are addressed. And that's where there is the need for more collaboration. And that collaboration, which for the purposes of sort of operational work at the World Bank was directed toward infectious diseases in humans and in animals, it's not all of health. There could be other areas of collaboration like mental health, but my presentation is basically about infectious diseases and antimicrobial resistance, and the way the intersections between human health and animal health and environmental health have to be better managed to reduce risks. Next slide. Yeah, it's not new. It's been around since 1960, this concept, and even since the 19th century. One easy way to remember what the difference is between the classical approach is that this is where institutions and professionals, people, they ask, what can I do? Like, I am a human health doctor, and therefore I am concerned about disease in humans. And the integrated one approach, which is for One Health, is what needs to be done. And this is where disciplines have to work together. And it's also a preventive approach. It works upstream on the causes of risks across disciplines. Next slide. Now, why One Health? The major reasons for why we are interested in having this approach adopted is pandemic risk, which is now quite obvious to everybody. It was not 7 years ago, as Andrei mentioned. It has been grossly neglected in our institutions and by our governments. There has just not been the attention to prevention and preparedness. And together with pandemic risk is the similar risk of antimicrobial resistance, which actually requires also a One Health approach to control it. And the other reason is that this is a huge problem for poor countries and poor people. And these are not the pandemic diseases like coronavirus, but there are endemic zoonoses. There are pathogens that cause diseases that occur both in animals and in humans, often in livestock, but also wildlife diseases. And there are astonishing 2.3 billion infections of humans every year with these animal origin diseases. And it's mostly poor people in the poorest communities, so it's very useful in addressing those burdens and that poverty problem, which also impacts on the way that wildlife areas are infringed upon by poor populations. So we need One Health approaches because they actually are macro critical. Now we are seeing that world GDP is dropping at least 5% this year. This is a very major economic crisis, not seen since the Great Depression. Yet the attention of policymakers hasn't been there, and now it's hopefully the One Health approach will get a push from this experience. And also it's a problem for the poor countries' economic development. Next slide. Now, one reason why it makes so much sense to use One Health is the dynamic of infectious diseases. What we see with zoonotic diseases, the one that originate in animals, is that first there is exposure in animals, then there are clinical signs in animals, then there is exposure in humans, and then there are clinical signs in humans, and finally, people show up in hospitals and health centers being ill. And what happens is that we don't see the initial stages because we don't pay attention to them because we don't use a One Health approach. Instead, we wait for people to have symptoms of illness and to have to die and be ill, to do something to respond to an outbreak, a disease, infectious disease outbreak. And the costs go up exponentially. So what we have on the left side of the slide is weak capacity for surveillance. And it says veterinary, but it's equally wildlife surveillance and environmental surveillance. And if there is no surveillance, then we don't know all the risks that are coming. So there is no control or preventive measures that are possible because we simply are blinded by the way the policies are set up. So it's a very costly policy choice to ignore the source of the contagion, and the cost goes up exponentially, and that's what gives it a very, very strong economic rationale. There is a very high rate of return to doing One Health approaches. Next slide. Okay, so despite this robust rationale, use of One Health approaches remains very elusive. We are very divided into silos. There is a dominance of the medical and human health sector in the pandemic and antimicrobial resistance space. And they tend to be more concerned with short-term patients that are already ill rather than preventing illness later. So there are all sorts of biases and neglect of prevention. It's also difficult to work across countries. Well, international cooperation is absolutely necessary. Institutions like the WHO are absolutely necessary, but they don't have the support of the members that they need. And there are two reports here that are referenced about One Health. One is a compendium of the framework for approaches that can be used, that was published just 2 years ago. And it's a good resource, and it's hopefully going to be used more now. Next slide. And now here to motivate interest in using One Health approaches, I was thinking of what kind of a situation is similar where it is critical to work together. And one is a racing crew on a yacht race. This is Cows Week in England. And so what does a crew have to have? They have to have leadership, somebody with authority and information, data, surveillance, and a means to steer, authority to make people do what is necessary. And that is, we lack that for One Health so far. Because it's not clear which sector it should be, leadership belongs in. Then each crew member has to have a defined task, but they have to cooperate and watch each other as they go. The solutions mapping that the EndPandemics.Earth has put together is definitely part of the toolbox that is necessary. Because without coordination, they are going to lose the race, and the boat may even sink. And this was written 2 years ago, so that the emergence of novel zoonotic pathogens is not if but when, and the coronavirus is not the last zoonotic virus that we have to respond to. Thank you.
Thank you very much, Olga. This was very both educational and inspirational. So let me now switch to our next speaker, and that would be Professor Lu Jahai. I'm just launching the slide. Professor Lu is the director of One Health Center of Excellence for Research and Training in Sun Yat-sen University in China. He is a distinguished health professional with primary research interests in One Health, epidemiological assessment, vaccine development, prevention and control of parasitic and zoonotic infectious diseases. His multiple leadership roles include President of Guangdong Federation of Science and Technology Laboratories, Vice President of Guangdong Tropical Medical Association, Vice President of Guangzhou Chinese Preventive Medicine Association, and Adjunct Professor of the State University of New York. He is connected from Guangzhou, China. Professor Lu, you have the floor.
Hello, everyone.
Hi.
And I prepared the PPT, but now I'm using the cell phone. Don't share the PPT. So I only talk my idea.
That is fine. Please go ahead.
Hello, everyone. I hope you and your family are all well during this challenging time. I'm glad to have this opportunity to share my experience and the story related to the promotion One Health in China. As you may know, China leads the world in agriculture and animal husbandry production. This is driven first by pork, beef, and lamb, and followed by poultry and seafood. As the largest producer of the pork, China produced over 55 million tons in 2017. The European Union ranked the second, and produced just 23 million tons. China is also the largest consumer of the pork, with the national annual consumption of nearly 55 million tons. Since the transformation and the expansion of the domestic market in recent decade, Chinese diet become increasingly more diverse, and Chinese people purchase a significant high amount of the high quality protein, such as the beef and the lamb. Additionally, China has more than 300 million agriculture relevant workers, including more than 10 million workers for animal husbandry. In summary, China possesses the world's largest consumer market for animal-related products in terms of the production and consumption, and has the largest community of the animal-related worker. The expansion of the animal market brings not only economic benefit, but also a higher risk of zoonotic disease, such as the brucellosis. Nationwide cases of the brucellosis infection disease from 1992 to 2019, and this increase is related to the prevalence of the livestock nationwide. Besides the traditional livestock, wild animals are also play an important role in the spread of the emerging and re-emerging infectious disease. Although long banned by law, illegal private wildlife trade is still rampant. After the outbreak of the COVID-19, the Department of the Agriculture issued the wide list of the edible animal to distinguish between domestic and wild animal. In addition to the most common species, there are certain rare livestock on the list, including sick deer, red deer, reindeer, opaca, and others that are classified as a non-domestic edible animal. However, where we have a long cultural history of the cultivation of this certain animal, close connect them and the humans in the process of the farming, slaughtering, and milking process and the fur processing may act as the source of the emerging infectious disease and represent the potential risk to the public. SARS in 2003 was an important turning point for both the development of the public health system and the One Health concept in China. Since then, China is gradually strengthening the public health system and adopt a joint mechanism for the prevention and control of the emerging infectious disease. This cross-section cooperation is also what the One Health movement advocates for. During the control effort of the H7N9 avian influenza, the Department of the Health and the Department of the Agriculture cooperated to mitigate the outbreak by implementing measures including poultry diagnosis and culling. The Department of Agriculture supported scientific research developed the effective vaccine to control the spread of the avian influenza. The notion of the health community of the mankind advocated by the Chinese government in the COVID-19 pandemic is also a concrete implementation of the One Health approach. After the outbreak of the COVID-19 in Wuhan, China immediately closed wildlife market, stepped up enforcement of its existing wildlife protection law, and acted to prevent the people from eating wild animals. These are specific actions to practice One Health. In the past few years, and as a fellow of the One Health principle, I have established the first One Health research center in China, held One Health international conference and a training session and the research project. My team has also worked to develop the better method for the prevention and control of the emerging infectious disease. This suggested method include the first, establish the International One Health Alliance to develop the technical training and build a cross-country collaboration. The second, from the human, animal, and the environment perspective, to establish the team of the specialists to promote biosecurity education and to conduct the research on disease prevention techniques. And the third, call for the wildlife trade ban, legislation, and education on wildlife protection. I am honored to be part of this wonderful global One Health initiative, and I wanted to thank the organizer for this great opportunity to share my thoughts. I'm looking forward to hear solutions from other countries. Thank you.
Thank you very much, Professor Lu. This was an extremely insightful presentation on how One Health approaches are dealt with at the national level, at the level of national policies and capacity building. From here, let me proceed with our next speaker. And I'm sorry. One second. I'm giving the floor to Alexander Shestakov. Dr. Shestakov is the director of the Division of Science, Society, and Sustainable Futures at the Secretariat of the Convention on Biological Diversity, the CBD, based in Montreal, Canada. In this position, he plays a key role in coordinating the development and negotiation of the post-2020 Global Biodiversity Framework that would be submitted for approval by the next conference of the parties of the CBD early next year in Kunming, China. Educated in geography and environmental law, he has a rich and diverse experience in environmental management and policy, working for academia, government, international organizations, private sector, and environmental NGOs. Prior to CBD, Dr. Shestakov was the director of the WWF Global Arctic Program and the WWF representative to the Arctic Council. He is now connected from Ottawa, Canada. Alexander, you have the floor.
Thank you, Andrei, and good morning, good afternoon, good evening, colleagues. Thanks a lot for organizers to come with this very timely initiative. And definitely, while this event is probably one in the series of events related to pandemics and also recovery after COVID-19 crisis, that's actually every voice is counting today. Every voice bringing us closer to solutions, and every voice raising the issue, including at policy level. So it's really clear now that after a few months, we are in a COVID crisis, that COVID-19 revealed many systemic issues, including risk-related issues, where actually no proper value is given to nature, to efforts for conservation and sustainable use of natural resources. But as we also heard before, basically to addressing the root causes of issues, including root causes of zoonotic diseases. While of course we have a very significant crisis in many spheres, and it's in health systems, but also in economics, and we also know that environment is also affected, as a number of cases are requests for lowering environmental standards. At the same time, current situation is bringing also a number of opportunities as well, and we need to use those opportunities. And those opportunities include what we can do differently, what we can do better to react and not only to rebuild the world after COVID-19, but also looking forward, first of all, for the future reduction of risk and prevention of new pandemics. And we heard already from Olga that it was definitely not the first pandemic, and unfortunately will be not the last one. The key from perspective of the convention is definitely to address root causes. And that needs to be in the heart of any policies and strategies to rebuild the world after COVID-19 crisis. And that includes much wider use of nature-based solutions, much wider efforts into investment into nature conservation and sustainable use of resources, which is actually well paid. Sometimes it's maybe not a short-term gain and maybe longer than election cycle as well. But in a long term, it's a really well-paid investment. And that's another point, re-evaluation of attitudes to nature and environment and biodiversity and how those elements are incorporated and factored in economic development. One Health, this is a concept very much also at heart of interactions between our convention and WHO system. It was welcomed at our last conference of the parties in Egypt in 2018 and will be further developed. And again, the key point is not only look at economics, but of course the primary goal of One Health is to ensure lives of people, but also to ensure life on Earth. And that's again important component of One Health, where we are thinking about co-benefits and multiple benefits of maybe one particular action. And that's what we need to think about, because when we are rebuilding after the crisis, so we should look at those solutions which may both benefit well-being and livelihood of people, support human health, and at the same time provide benefits to support healthy planet. So Andrei mentioned the development of global biodiversity framework, the post-2020 global biodiversity framework, which convention with all its 196 parties and many observers and stakeholders working very hard. And we expect that that will be approved at the conference of the parties in China in 2021. We also know from last global assessments actually issued also last year that the 5 key root causes, not the only, but key root causes and direct drivers of biodiversity loss are actually unsustainable agricultural expansion, climate change, pollution, invasive alien species, but also direct overexploitation of biological resources, including wildlife. And thus the global biodiversity framework is designed as a way to address those root causes and address those elements of crisis as also was shown, I think, very nicely on the Olga's graph, which are coming at the early stages of pandemic. So we need to deal with degradation of ecosystems and actually stop it. We need to ensure that ecosystem restorations happens where it's possible, but also where it's most effective to achieve both environmental gain, but again, support local communities and livelihoods. The conservation of biodiversity, including the system of protected areas where a number of wildlife species may stay untouched, and reducing contacts with humans, that also may help. The control and where necessary eradication of invasive alien species. And many invasive alien species are actually a source of pathogens and can bring new and can bring it to the human communities as well. So that's important component of the new framework as well. Expansion of nature-based solutions. And although nature-based solutions sometimes are used mostly in a climate change context, which is continue to be extremely important. And we know that probably up to as much as up to 40% of reduction in greenhouse gases and mitigation measures can be achieved through nature-based solutions. But nature-based solutions help in many other areas, including supporting health. Sustainable use, and as we are speaking here of wildlife, that's an integral part of the framework, including providing for legality of the trade and elimination of illegal trade, but also definitely regulating harvest, as well as regulating and ensuring sustainable use, also addressing the health issues. The key pieces are still consumption and production. And post-2020 Global Biodiversity Framework is also looking at changing those patterns. We need to produce differently. We need to introduce a new production practices which are sustainable, but which are also use integrative approaches, as One Health suggests. But we also need seriously think about the way we consume. And that's actually for all people. That everyone can play a specific role in changing consumption patterns. And finally, all those nice measures probably will never happen if special conditions and implementation conditions are not in place. So we seriously need to see that the level of funding, especially funding and resources coming to developing countries, are actually commensurate to the ambition of our goals and our targets. The capacity building and capacity development is an essential part. In many countries, all things we are talking today, including control of diseases, including surveillance, including tests, including control of markets, is not possible because capacity is lacking. So we seriously need to invest. And definitely science. Science knows a lot, but even this time with this crisis, we face a situation when science was not completely ready, and we need to know much more, including about interactions between wildlife, degradation of ecosystems, and potential for new pandemics. So basically all this need to be in place if we like all things we are talking about be implemented in real life and implemented on the ground. So I stop here and further just make an appeal for everyone to be part of it, as probably never before. We need unity and focus on implementing good and new solutions. Thank you.
Thank you very much, Alexander. I guess I can use it as a bit of an advertisement that tomorrow your organization, the Secretariat of the CBD, together with the Secretariat of the World Health Organization and WWF International, are having a very important also webinar addressing planetary health issues. And So our conversation today is a very direct and kind of useful connection to that kind of higher level policy discussions. And certainly we will follow up with the various players in this area. Thank you again. And let me now move on to our next speaker, moving from policies to frontlines. And we are now asking Suwana Gauntlet to come to the floor. Suwana is at the forefront of endangered species conservation. She's the founder of Wild Aid and also the founder and CEO of Wildlife Alliance. Working directly with wild habitats, she applies a direct action approach in saving threatened forests and preventing species from extinction. She has 25 years of experience in strengthening parks and reserves around the world, combating illegal wildlife trade, and rescuing thousands of trafficked animals in Southeast Asia. She has worked in Cambodia for the last 20 years, where she directly manages 8 field programs. She is now connected from Phnom Penh, Cambodia. Suwana, the floor is yours.
Thank you, Andre, for the great introduction. And I'd like to thank Steve Galster for bringing us together and creating such a needed campaign. I hope our joint efforts will be successful, and that I can share with you what we found has worked in preventing contact between live wildlife and humans in Southeast Asia and East Asia. So Wildlife Alliance, as Andre said, is a frontline NGO based in Cambodia, but we have also impact on the transboundary trade to China. We are the boots on the ground, working in close partnership with government and communities to fight the relentless Pan-Asian illegal wildlife trade for the last 20 years. And we all know, and that's what we're talking about today, that over the last decades, the global wildlife trade has given birth to HIV, to SARS, Ebola, COVID-19. But there is no sign that the wildlife trade is abating. And we know that, and thank you to Steve for bringing us together, we know that we need to apply coordinated solutions. Otherwise, the next pandemic is right around the corner. Viruses and bacteria are the components of nature that we have no control over. But this is really bringing us to our knees, this pandemic. And these viruses and bacteria have the bad habit of jumping to humans when a large number of wild animals with compromised immune systems are crammed into small cages and they come into contact with humans. The question that we are all asking today is how we can prevent that jump from wildlife to humans. How can we stop this time bomb? We need to address the root causes simultaneously from multiple angles, which is what this matrix shows. This matrix, which the EndPandemics.Earth has created, and shows a complex web of solutions, which hopefully by us all coming together, we can address at the same time. We can, through our, each one of us, through our specialties, we can bring effective action in each of these categories, which is reducing demand, expanding natural habitats, stopping trafficking, securing livelihoods, and changing business practices. This way, we'll be going forward with a full deck of cards in our hands. And right now, we have not gone forward with a full deck in our hands, just one card perhaps, and things have gone wrong. So how does Wildlife Alliance fit into this web of solutions? We are taking action locally here in Cambodia and transboundary with our neighboring countries by facilitating policy changes on the wildlife trade, by raising political will, by working with rural communities to help them stop wildlife poaching. And what people rarely talk about, we are also strengthening law enforcement on the ground to arrest wildlife traffickers and seize wildlife shipments smuggled to neighboring countries. So to date, we have arrested, working with the government, the government officers that we work with, have arrested over 7,000 wildlife traffickers. I think many of you know that wildlife trade is operated by global criminal networks. That is why law enforcement is so important. It is not just the community selling wildlife. So if we implement community programs, that is important. That's a part of the solution, but it is not enough. Changing policies also is not enough because criminals don't listen to policies. Wildlife Alliance will be happy to share the solutions that we know work, and we will help EndPandemics.Earth to add to the solutions map that's being built. So Andre asked me to share some things that work with the community that we have been implementing for the last 20 years. So here they are. We start with bringing to schools health education related to the illegal wildlife trade. We touch about 50 schools a year, reaching thousands of students, training teachers, and talking to thousands of adults and communities for entertainment in the evening through shows on wildlife and health. We transfer manual job skills to adults. We provide agriculture inputs, where this is an irrigation system. And we help set up microcredit schemes. These ladies that you see here are the microcredit scheme group in Savannah Baitong, a village that we helped starting in 2003. And these ladies are very apt at discussing and solving the lending issues in the village and making sure that people do repay their loans and that everything is according to sustainable agriculture. But what I really want to share with you today is what I've learned over the last 20 years on wildlife law enforcement here in Cambodia and how it is at the heart of fighting future pandemics. When I arrived in Cambodia 20 years ago, wildlife was being sold everywhere in very unsanitary conditions, in restaurants, on sidewalks, in markets. Bears would be waiting in cages outside restaurants for their next paw to be cut off. You can see this bear already had one paw cut off, and it was served to VIP customers in a restaurant after their golf tournament to make them stronger during the next golf tournament. Macaques waiting for their brains to be eaten alive so that people could be smarter from it. Tiger cubs in 4-star general living rooms to show off as a status symbol. What we have experienced is the best results. What we have experienced produces the best results is working closely with the government, law enforcement, judicial police officers. And why is that important? Because they're doing their work, but we're there to help them uphold the law, which was not happening before we arrived in Cambodia. If we want to actually, because our goal is, let's remember, to reduce the number of live wild animals crammed in small cages, smuggled across borders in completely unsanitary conditions, and being sold on wet markets. So in order to do that, we have to roll up our sleeves and we have to work hand in hand with judicial police. This is what happens on the ground. If we don't, we cannot reduce the actual number of wild animals reaching the markets. So as we know, the real problem is that these animals have an immunocompromised system. They are extremely stressed. They haven't eaten or drank water for days. They can't even turn around in these cages. And so therefore they are a time bomb brought in contact with humans. And all it takes is one human to then propagate it to other humans. Wildlife Alliance, we operate on the ground with 2 types of law enforcement agencies. One is the Ranger Protection Program in one of the source areas, the largest source area in Cambodia, the Cardamoms. And the other police force that we work with is the Urban Wildlife Police. I actually helped create this Urban Wildlife Police in 2001 with the Forestry Administration. And what this captain is showing you is frozen wildlife meat that was being sold at a restaurant down south in Endontuk. And per year, we confiscate several tons of wildlife meat and body parts going to Chinese medicine. This way, we fight the whole supply chain, the source, the transit, and also the consumer demand. We have a really neat campaign going on right now, which is called Stop Eating Wildlife. And we have several actors playing roles in videos of how they eat wildlife and they're very proud of it. And then they fall victim to the pandemic COVID-19. And it's being shared by a lot of, actually thousands of viewers so far. So every year we stop 4,000 live animals from reaching wet markets. And since we started in 2001, we've stopped a total of 70,000 live animals from reaching wet markets. And what I've learned, it's a tough lesson, but it's the truth, is that it's not enough to rely on governments to implement law enforcement. That's what most NGOs do. They rely on government, they say this is their job, not ours, to participate in law enforcement. And unfortunately, all the developing countries that I work in have good laws. They have really good laws and usually good policies. But what is missing is enforcement of these laws on the ground. That's where we, NGOs and civil society, come in to play an active role to help the government uphold the law, fight the trade on the ground, and not just be content to facilitate better policies or writing scientific reports. Am I over time? Okay. So I'm not over time.
You are, but if you can finish now quickly, that would be great. Thank you.
Okay, I'll finish. Yes, the biggest challenge is corruption, which makes, okay, you can see this car. This car is a police car transporting endangered tortoises to the Vietnam border. And here's our unit, headed by the Forestry Administration and with military police and us as civilians stopping the car. And the biggest contribution that we've made in this country is, one, we've closed all the wet markets. There aren't any with wildlife anymore. Restaurants that served wildlife were closed by the mayor of Phnom Penh 15 years ago. We don't have wildlife served in most restaurants. And the other contribution is we are making sure by our presence that wildlife that are seized, like these tortoises, are not being resold. That's what happens in most countries. And that's what was happening before we arrived. Wildlife is rescued and then it's resold into the black market. So on a daily basis, we are having an impact on the behavior of government officers, which is one of the most effective ways that we found to reduce the actual illegal wildlife trade. That's my last thing is sales on social media. We are today facing exponential challenges, which is that a lot of the wildlife is being sold on social media. And in the last 9 months, we have investigated 42 cases and cracked down on 39 cases. Clearly, we cannot come out of this pandemic continuing to do conservation as before. Conservation is as guilty as the other sectors of society. We have not done enough. We have focused on the comfortable things, which are community work, scientific research, workshops, train the trainer, but something went wrong. Conservation tools are important in fighting the wildlife trade, but so far they've been totally ineffective. And they're not enough to stop future pandemics. Conservation needs to take a turn today. And we hope that with this movement, this campaign, we can lead the way. Thank you very much.
Thank you very much, Suana. Very visual, very hard-hitting impacts on the ground, front lines, and working with communities is the foundation of everything. But it needs to be augmented by these other impacts through businesses, through policies, and ultimately addressing consumer behaviors. Thank you again. So now let me move to our final speaker for today. We are I'm asking to Steve Walker to join us. Steve is the founder and CEO of Task.io. It's a UK technology company. And he has been in the startup space since many years ago, since 2003, launching first a software as a service company, Idibu, in 2007. His mission is to make technology provide us with the insights we need to help consumers, employees, and donors make better decisions through transparency. Steve is now connecting to us from the wonderful resort town of Hua Hin, 3 hours south of Bangkok in Thailand. Steve, the floor is yours.
Thank you. Thanks, Andre. And first, thanks to everyone who's joined the webinar today. We really appreciate your time. For us at Task, we're very proud to be supporting the End Pandemics campaign, and we're very keen to contribute to targeting consumer behavior, given it's an End Pandemic key impact track. So at Task, our mission is to help organizations engage their teams and track activities that support their social and environmental missions and provide proof of impact back to the markets. Now, one of the reasons this is important is because it enables consumers and employees and donors to make better decisions about who they provide their support to. So I started this business a couple of years ago as part of a personal mission to use my technical and startup skills to create technology that promotes positive behavior. My own personal belief is that we have to change the incentives which are driving commercial systems. And these systems, they're the most powerful change agents that we have available to us right now. And with the right incentives and beliefs, this change can be fast. So, people are making decisions based on the information available to them. And we're seeing in many cases, very poor outcomes thanks to the lack of evidence provided, or as is often the case, a biased presentation of data that's being driven by big business and short-termism. Let me just share my screen. So, first, I want to contrast two cases around track data and the differences in outcomes. So the murder of George Floyd was caught on security cameras and bystanders with their mobile phones. And the evidence of police brutality is now sparking a global movement. Epstein, on the other hand, he died in prison with security cameras switched off, meaning that data got lost on the way to his grave. So whatever your view on conspiracy theories, my point is that truth is a powerful change agent, but only when we can provide absolute proof. George Floyd was not a billionaire like Epstein, but the data gathered during his demise will likely see a change on a scale that he would never have ever imagined. I'm going to highlight some challenges and success in the world of data tracking. And the first place I like to go to is our first client at Task, which was Freeland. Now, we worked together to pioneer a program that aimed to increase rewards to the forest rangers and local communities protecting tiger populations in northeast Thailand. And here we've got a great example of the challenges that people like Freeland face in behavioral change. If you're a young adult in a target area and you're looking at your career options, one is to be protecting animals for less than $9 a day, and your life is potentially at risk. Alternatively, you can look to earn $30,000 for one day's work by providing a single tiger carcass to the black market. So, we face very, very tough incentivization challenges. But if you look at the COVID pandemic, we've seen society suddenly placing increased value on, for example, frontline workers who are risking themselves to look after other people. Now, how can we do the same for the forest rangers and the community members in remote areas who risk themselves for our collective benefit? So we have to use data tracking to expose the great work that's happening. And we have to reinvent business models and incentives in which more funding flows into these communities and brings a balance against the incentives to do wrong. Next, I want to introduce you to Bill Borman, who I know through my history and recruitment software. And what I love about Bill's story is how a very small number of people can impact a large number of lives. So Bill lives in Northampton, UK, which has seen a dramatic rise of rough sleepers during COVID. Many of these people, they're migrants from outside the UK. They're outside the UK social system, and they're struggling to get support. At the same time, soup kitchens are closed down due to social distancing, and temporary housing is already full. So Bill has been delivering food and essential supplies around the town and using tasks to track activities. For example, the initial assessments of new rough sleepers, so they know how many people require help, tracking the delivery of meals and food packs, and also creating safeguarding reports. And that's people that they believe are at risk, so social services can contact them and assess them. So through his data tracking, he's been able to increase donations by providing supporters with latest reports on real-time reports. And you can see in this slide, you know, the fact that he delivered 465 meals in the last 10 days. He's also got the local council to now accept that there are in fact more than double the amount of rough sleepers in the town than was being officially reported. And this is paving the way to getting more support from government. Another example of how the data is being used is the fire department are accessing his reports because the geolocations of the tent sleepers let them assess increased fire risk. And you know, for me, you know, Bill represents the power of individuals to make change, and it's specifically his data-driven approach, which means that he's getting leverage that other initiatives are simply missing out on. Finally, I want to highlight the work of Bangladesh Animal Rights, which is an organization that we started working with recently. They coordinate getting funding to other animal-focused NGOs throughout Bangladesh. And one of their initiatives looks to provide finance for injured animals requiring emergency treatment. Now, currently, the method to find funds for this is using a WhatsApp group, and finding a donor can take around 2 hours, which means during this time, the animal is on the road or wherever they're located suffering. We can improve the support model by increasing donor confidence through data tracking. In this new model, donors see their funds escrowed, which are financed to the specific activities of ambulance call-outs and hospital admissions. So now when an NGO has an animal in need, BAR can release the funds instantly. The onus is on the NGO to track the animal being supported, and this gets real-time updates to the donors, including copies of invoices and bills. And this change by BAR sees them able to help many more animals. It removes the 2-hour window of suffering, and the reports created by the NGOs on donation use are also reused as marketing content to secure more donations. So this is a great example where simple transparency is solving multiple issues. So just to draw some conclusions before I hand you back to Andre. We often hear the expression that leaving money on the table, but I believe we're leaving a lot of change that supports the One Health and EndPandemics goals on the table too, because huge amounts of data is being lost that could help support change. And there are many people in the world pursuing great causes, but their voice is often not heard. So as consumers, employees, and donors, it's not always easy to make the right decision. And the marketing power of big business means that we can be swayed, and the economic incentives often don't give us the results we want. The power of evidence-based proof can create revolutions, and it begins by letting consumers and employees strip away the layers to truly understand the businesses and the causes that they support. So many thanks for listening, and please feel free to shout with any questions. Back to you, Andre.
Thanks so much, Steve. This is really where my mind really starts shivering at the prospect of transformational change that we can all launch by tapping into the new technological solutions to really reach out to every citizen in the world and to empower and incentivize their actions towards a common goal. So this concludes our lineup of speakers for today. We are slightly falling behind our time, but we have been receiving and tracking questions through the chat in YouTube and Facebook. And let me first do the following. I first want to announce that due to kind of some last-minute confusion, we have not received on time the slides that were prepared by Professor Lu from Guangzhou, China. And we will make all presentations available in the report of this event, including the slides from Professor Lu. That's one thing. Secondly, let me now read a couple of questions. Some of them are addressed to Olga. Olga, if you're still here, we have, if you can come back. Olga, are you there?
Yes.
Yes.
I'm here.
So, yes. So there's a question from Charlotte Jean, and she's asking, compared with non-communicable diseases, to what extent the communicable diseases will be the heavy health burden in the globe? How to prepare for the future? So maybe if you can give a short answer, and we'll invite people to follow up more in depth later. Thank you.
Okay. So I want to share the screen. I have actually a table that shows exactly this. Can you see it?
Nope.
No?
No.
Okay, I'm clearly not doing something right here. Okay, in short, the health sector is very much one where there are many needs. You know, sometimes people say that the needs are infinite. You can spend more and more on health. And there are different, advocacy groups for different kinds of disease specific spending that are constantly, arguing for more allocation from public funds, or trying to get more funds into that specific health problem to try to address it. And the example that the questioner asked was, how do we compare investing in reducing the risk of non-communicable diseases that are known to be a problem and an increasing problem everywhere, and quite costly? How do we compare it to investing in preventing pandemics? And actually, this comparison is quite possible because WHO has done a calculation about the benefits that you can get from investing in reduction of non-communicable diseases, and those benefits would be about $25 billion per year, using the most effective interventions and investing in them. And they would cost about $8 billion a year. And so you would get a benefit to cost ratio of 3, meaning that for every dollar that you invest in non-communicable disease reduction, you make back $3 for the society and everybody's welfare. This comparison is also possible for pandemic risk reduction, and it's quite dramatically more sort of points to how beneficial these investments are. We come out with a benefit cost ratio of 18, meaning that if you invest $1 in reducing pandemic risk, you make back $18. Not all of this is health benefits. Some of it is societal benefits, because as we see now with COVID-19, there's immense societal disruption that occurs, an economic shock that's very costly to everybody, and reducing that risk is actually a highly productive investment. So the short answer is yes. You should invest in both because both are clearly beneficial. But actually, the pandemic risk reduction is about 6 times more beneficial, right? Because the benefits are just so much greater than the costs of reducing pandemic risk.
Thank you, Olga.
Short answer.
Yes, thank you. And we will also attach your slide that you wanted to show to the webinar materials.
Sure.
There is another question which from Dr. Nizam of Bangladesh. He's addressing it to you, but maybe you're not fully in a position to answer. I'll read it anyway. Is there any current policy from World Bank to strengthen and the functioning of One Health in South Asia region for combating future pandemic threats in this area? If you cannot answer, we'll make sure that
Yeah, I mean, it's been a very marginal topic within the World Bank ever since it began in with the avian flu response in 2006. We began working in a One Health manner, at least on that response, but then it ended, so it went it kind of went away. Now I understand it's being resurrected and we are looking for ways to re-engage. The question is how sustained will this interest be, because inevitably new problems come up, new topics, and this has been very much sidelined for the last until 2010 and 2020 when the COVID response started. It was really a marginal topic. So I hope it is increasing.
Well, obviously not anymore. It's I mean, it's not anymore a marginal area. I mean, we are in contact with colleagues in the World Bank in the various global practices of the World Bank. Yeah, and we'll make sure to follow up with them, and in our next iterations of this global webinar format, we'll seek to invite them and also engage in discussing how the solutions can be cascaded from kind of either top down or bottom up. I have another question from Jimmy Desmond. I think I'd like Steve Galster to try to answer this question. Is the EndPandemics campaign able to provide materials and funding to print and distribute to countries like Liberia, who are doing significant international wildlife trade or illegal wildlife trade work and showing success? Steve?
Okay. So the campaign is in the midst of setting up a collective toolbox, which will include tools for behavior change, awareness, anti-poaching, sustainable farming, the gamut of subjects that we cover in our integrated and holistic approach. So there will be materials that we definitely can share, and we're going to be developing new materials. For example, just one of many examples like that 1-minute spot we showed before. We're getting that translated into different languages, Chinese, French, Spanish, Arabic, Thai, etc. But beyond that, there are already many tools that each organization, we have almost 30 organizations that have brought to the Alliance, and we're creating an archive, so to speak, that people will be able to reach through our website, download, or sometimes get directly from the Alliance partner. Now, with regard to funding, we are also putting together a grand global plan to not only raise awareness here, that's a big part of the campaign, but to also put wind into the sails of each EndPandemics partner. So if you want to join up, and if you are doing something critical toward the One Health strategy, protecting nature, protecting wildlife, but also the other elements, supporting compassionate, sustainable farming, and everything in between that we've heard about during this webinar. Get in touch with us. It's easy to do that. I think you probably got the details through this webinar, but we are teaming up with each other and with organizations outside the Alliance to flesh out a plan, get money, and get stuff done. Thank you.
Thank you, Steve. There's one final question. I'd like, it's obviously to Alexander Shestakov. Alexander, are you still there?
Yes, Andrei, go ahead.
Yeah, perfect. So the question is, what are the current practical opportunities from the civil society to engage with the negotiation process leading towards the COP15 and the new global biodiversity framework, so that the realities of the post-COVID world are duly reflected there? Can you give us some guidance on this? Thank you.
There are several opportunities for civil society and overall stakeholders being engaged. So first of all, of course, through meetings, upcoming meetings. And later this year, early November, we will have what we call meetings of subsidiary bodies of the convention. The one is subsidiary body on scientific, technical, and technological advice, and another one on implementation. So both meetings in early November, they will consider certain elements to inform global biodiversity framework, including an essential part of it, monitoring framework, which will include monitoring elements, but also indicators for measuring the implementation of the framework. So that definitely partners and any organizations are welcome to be part of those meetings, including presenting what they are doing through the system of side events. Not directly negotiation process, but side events on margins of the meeting. Also, in a few weeks, we are planning to issue for wide peer review process the initial draft of the monitoring framework for global biodiversity framework, which will include the components of goals and targets, monitoring elements and indicators. So that will be open for probably a month. So again, any contribution in a written form from anyone interested, and those submissions will be actually processed and again used by the team in preparing the next version. Also in probably next February 21, we will have the third meeting of the open-ended working group on post-2020 global biodiversity framework. That will be the final meeting of this group, actually finalizing the draft framework. So again, this meeting, as other meetings, are open for observers, and civil society can be part of it. So there are those numerous avenues at this stage which anyone can use to contribute to the development of the framework. Thank you.
Thank you very much, Alexander. With this, we are already out of our time. I am using my power of the moderator to close the line on our discussion. Let me summarize. I'm not going to summarize the entire conversation that we've had, but more like throw in a vision of where we are going with all this. You've already seen a couple of times this matrix, this map of solutions, and those little kind of blotches of yellow across the various cells of the matrix is kind of my artistic rendering of where we might be right now. That we are shooting a bit of a scattergun approach with some traditional types of activities, a lot of them focusing on frontline and community work and habitats and the stop trafficking arena and some others. Obviously, public policies work is active to some extent in a number of action pillars, etc. But I mean, much less so, certainly visibly, and so that the world knows that we see the other impact tracks, the business, changing the business practices, or affecting consumer behaviors. And there are also other possible impacts and other possible types of activities. So that's where we are right now. And by putting our forces together as a crowd, and we are intentionally having a very light structure, but heavy on impact, so that this converts into a very focused shooting, so that we all hit all the targets and use the power of the crowd to create these solutions at various scales in various geographies, at various sectors, and connecting between the sectors and the levels of impact. So this is where we want to go. And with that, I will be. I would want to kind of leave you as a result of our hour-and-a-half conversation. Let me throw back for a final word to Steve Galster as our leader of the pack. If you want to say a few words, kind of to where do we take it forward? But please.
Thank you, Andre. Yeah, and we're an egalitarian alliance. We helped start this, but Andre is my counterpart. We're all equal shareholders in this. But thank you. Two points, I guess. One, speaking to our question from our colleague from Liberia before, this is a question that comes up a lot: is how do we fund this stuff? How do we share best practices? But really, a lot of it comes down to the money. And speaking back to Sawana's point before, we've done something wrong to get here. And I think overall, if the world has done something wrong that we want to correct, is we did not invest in nature protection. And look where it got us. Now we have a chance. We got off lucky this time. This is a light pandemic compared to probably the next one. So we need to invest in nature protection. 0.00001% probably of the destructive invoice that COVID is going to deliver to the world of over $10 trillion, and they're talking about it mounting even more. We don't need that much to protect wildlife, to protect the wildlife habitats, and also to promote sustainable, compassionate farming. So I think we need the world to invest, and we need to make sure that that money doesn't just go to a bunch of big contractors who stuff the money in their pocket, nothing gets done. We need it to go to the front lines, okay? The other thing I think the lesson is, we've tried for years and years and years, decades, to regulate the commercial trade in wild animals. And with very, very few exceptions, it doesn't work. And it's because of the uneven economics in the world, the lack of enforcement, and the corruption. I think we need to stop this experiment, because I think that's also what got us here. So we want to end the commercial trade in wild animals. The virus does not discriminate between legal and illegal animals. We want to rebuild wild habitats, and we want to take care of people too by promoting sustainable, compassionate farming. There's a way to do all of that. That's what our campaign's about. We hope you all join us, and I really appreciate, Andre, you organizing tonight's event, and thank you. Back to you.
Thank you, Steve. So with this, I'm happy to just put, I have my kind of final pitch slide to everyone. Look again at what we have done and what we are really ready to do together, and join us, help us grow as a crowd. As Steve said, we are egalitarian. There are no bosses here, and we look forward to you're connecting to through our website and starting to be part of our weekly and other regular activities. And we look forward to our next meeting in the next few weeks or a month. We'll see how it goes. Thank you very much, everyone. And